there are two resources right now that I would encourage people to go to. Believe it or not, the first one is the actual Social Security Administration's website, which is www.socialsecurity.gov. If you're on disability insurance, you can actually go to that section of the website, and it'll give you all these rules for you to look at, read, try to digest, understand, the same way with the SSI rules. So the Social Security Administration's website is not hard to navigate. It's a great wealth of information. It probably has more information than you're going to even want to think about going to and reading, but I would use that website as a good resource tool. There's also a system in place that the Social Security Administration funds with local contractors, so at the grassroots level. And those programs are called Work Incentives Planning and Assistance. The Social Security Administration contracts with these organizations, and then these organizations hire individuals who go through a federal certification training. Those specialists then will be available to beneficiaries, people who are on SSI and people who are on Social Security disability insurance, to meet with folks one-on-one to help them understand all of these work rules and also additional programs that enhance earning even more money or protecting the health insurance that goes with these benefits. And we haven't talked anything at all about the health insurance piece, so I want to add that if you're eligible for SSI, you're also almost 99% going to be eligible depending on what state you live in. And here we are in the state of Colorado, so I will tell you, if you're getting any SSI, you're going to be eligible for Medicaid. That is the health insurance that goes with SSI. If you're on Social Security disability insurance, 24 months after you're eligible for that cash payment, you're going to be eligible for Medicare. And yes, it's the same benefit that senior citizens get. It's the health insurance that goes with disability insurance. So there are programs called work incentives, and these specialists that get trained and certified to work with one-on-one with beneficiaries can help those folks understand the working rules and help them implement these other enhanced programs to encourage more wages, and also, while they're doing earning of the wages, protecting their health insurance, whether it's Medicaid or whether it's Medicare. So those are the two top resources that I would encourage folks to go to see. One is the website, and that's self-education. The other is to make appointments with seeing these specialists that exist in every zip code in the country. Medicare is a health insurance program that was developed to meet the healthcare needs of senior citizens. So when we retire and we receive Social Security retirement, Medicare was the health insurance that we have paid into all the time we've been earning wages, and when we retire, that's the health insurance that we get when we reach eligible age of 65. Those folks who have a work history, who prove that they have a disability, going back to that initial eligibility, also will qualify once they receive their disability insurance payment. 24 months later, will also receive Medicare. That's the same health insurance, because we've been putting into that all this time. It has three parts to it. Part A of Medicare is the hospitalization. There's no premium. So if you get hospitalized and you have Part A, that's your health insurance that you're going to submit. It also has Part B that has a premium to it that you pay every single month, and that's for medical services. So you go to the doctor because you have strep throat, or you go to an orthopedist doctor, or you go to a psychiatrist or an internist. That's your medical services, and that's what Part B buys. Part D also has a premium to it, and that buys your prescription drug program. So if you have medications, you use your Medicare card, and that Part D pays for your prescription drugs. Part C is existent. It is there for people who are in the renal dialysis or kidney transplant program because it's such a costly thing to do renal dialysis, and the rejection medication that comes with kidney transplants is so high. So that's the Part C of Medicare. Medicaid is a medical insurance that was created so that people who are in the category of being both financially and medically eligible, who qualify for SSI, can walk through a door to access medical insurance of Medicaid. The Medicaid program is administered by the states. It's not administered by Social Security Administration. It is administered by the states. And there's multiple kinds of doors that people can qualify to get to Medicaid. So there's multiple qualifiers, but SSI recipients are one of those doors to qualify for Medicaid. And if that is their only health insurance, if they don't qualify for anything else, then they use that when they go to the hospital. That's their health insurance. They use it to go to the doctor. They use it to get their prescription drugs at the pharmacy. And it's because they are need-based. They meet the qualifications both medically and financially because they're on SSI, and that gets them through the state Medicaid door in the state that they live in. But again, Medicaid is administered by the state.